guys remember synovial joints?
Yeah.
So the synovial fluid in those synovial joints also counts as transcellular fluid. And then there's also serous fluid found lining the body's cavities, within the body's cavities. Okay? So you need to know how the water is distributed, where the water is distributed, what these compartments are, what transcellular fluid is. Right? So now what we want to think about is we're going to do a little bit of an aside because water has something to do with ions. Okay, so just to remind you guys, the ions and where they're located. This green box is supposed to indicate a cell. Imagine this is a cell membrane. Everything listed inside this box is ions that are higher in concentration inside the cell. Anything listed outside of the box tells you that these ions are higher in concentration outside the cell. Okay. So again, distribution of potassium. Potassium is higher where? Inside the cell rather than outside the cell. Sodium is higher in concentration where? Outside the cell. Outside the cell, you also have higher concentrations of chloride ions, calcium ions, bicarbonate ions. Okay. Inside the cell, you have higher concentrations of phosphate ions, magnesium, and sulfate. Okay. This box here, you guys will be seeing a lot today, and you're going to get used to seeing this box. Imagine this box demonstrates all of the water in your body. This box indicates all of the water in your body. Okay. This line kind of gives you a relative distribution of where most of the water is. So most of the water is in the intracellular fluid compartment. Some of the water is in the extracellular fluid compartment. And again, all of these things listed here, blood vessel, plasma, interstitial fluid, and transcellular fluid, that all is in this compartment here on the right. Okay. You need to know that there are factors that regulate the movement of water in and out of this, in between these compartments. The movement of water in between these compartments, going in and out of these compartments, are regulated by hydrostatic pressure and osmotic pressure. What was hydrostatic pressure?
Pressure of the water.
Pressure of the water.
Pushing out.
Pushing out. So the more water you have on one side, the water is going to push out to the other side. Right? Water moves from high water to low water. That's hydrostatic pressure. What was osmotic pressure?
Pulling in.
Pulling in. What was pulling in?
Proteins or ions?
Ions, solutes. Solutes pulling. Wherever the solute concentration is higher, that solute is going to pull the water towards it. Okay? That's osmotic pressure. So we need to keep that in mind when we're thinking about where water travels and how it travels. Okay? So let's kind of think through how that works in the systems that you guys have learned already. So imagine here's your heart. These are the 4 chambers. Blood gets pumped to the left side of the heart, goes into the left atrium, then to the left ventricle. Then that blood travels out to the arteries, so aorta and other arteries. Arteries branch out into arterioles. Arterioles branch out into capillaries. So this is a capillary bed and this is a capillary bed. Blood then leaves the capillaries to go into venules. The venules lead into veins. The veins eventually lead back to the heart on the right side, right atrium. Right? Every time the heart squeezes, blood leaves the left ventricle and enters the systemic system. If blood enters the systemic system, there's more volume in the systemic system, so the blood pressure goes up. Hydrostatic pressure goes up, right? And you guys learned about the pressure at the level of the tissue, right? Guys remember that? So what are the pressures that determine movement of fluid out of the capillaries and into the capillaries? What were the 4 pressures? Memorize this part. There were 4 main pressures you guys learned about.
Interstitial.
Capillary pressure.
There's capillary hydrostatic pressure,
Oncotic pressure.
interstitial tissue pressure. Interstitial pressure or tissue pressure is the same thing.
Oncotic pressure? Tissue oncotic pressure.
Tissue oncotic pressure. And
capillary.
Capillary oncotic pressure.
Intracellular.
So which pressures had to do with water? Which of these is hydrostatic pressure?
So capillary hydrostatic.
Capillary hydrostatic pressure is a hydrostatic pressure. There's another one.
Tissue pressure.
Tissue pressure is a hydrostatic pressure. So both of these push out. And then oncotic pressure, so tissue oncotic pressure and capillary oncotic pressure, these are pressures pulling in wherever the proteins are. And these are pulling pressures. Okay. So if every time the heart squeezes, right, blood enters into the system, that raises the hydrostatic pressure in the capillaries, so therefore water gets pushed out of the capillaries into the tissue. So this is movement of water out of the capillaries into the tissue, and then depending on how much protein and solutes are in the capillaries, osmotic pressure will pull it back in. Okay. Now imagine every time every time the heart squeezes and the fluid leaves the capillaries to go into the tissue. We're down here. Here's another capillary. Water leaves the capillary to go into the tissue. That means the hydrostatic pressure inside the interstitial space increases, right? Because water has now entered this interstitium. If the hydrostatic pressure in this space is higher, every time the muscles contract, right, and the connective tissues move and yank on those filaments that are attached to the endothelium lining the walls of these lymphatic vessels open up. Because the hydrostatic pressure here is now greater than before, because water has left the capillaries to go into this space, now this water will be driven into the lymphatics. Right? How does the lymphatic move?
One way.
One way, with muscle contraction. So because one end is closed, every time water enters in the space, it's just going to move in one direction. As it moves, it's going to pass through these lymph nodes to get filtered, and eventually it goes back into the, where's here?
Venules, veins.
The veins, goes back into the vein. Where does it, at what point in the venous system does it re-enter into the capillaries? Or into the vessels? Where? Between the jugular and the subclavian. The connection between the jugulars and subclavian to bring that fluid back into the heart. Okay? So you need to remember that hydrostatic pressure has to equalize, right? Water outside the cell and water inside the cell have to equalize. The pressure has to equalize. So pressure inside the cell, hydrostatic pressure inside the cell should always equal the hydrostatic pressure outside the cell. Okay? So that means that the net fluid movement of water in and out of the cell, is due to any changes in osmotic pressure. So movement of water is dependent on osmotic pressure. Okay? Dependent on hydrostatic pressure, dependent on osmotic pressure. Osmotic pressure, again,
Can you repeat that one thing? Movement of water depending on
movement of water, net fluid movement right here, is due to osmotic pressure, changes in osmotic pressure. We said that the net movement of water is regulated by hydrostatic pressure and osmotic pressure. Okay. We also said that the hydrostatic pressure inside, because we've got two pressures here, hydrostatic and osmotic, the hydrostatic pressure inside the cell and outside the cell have to be equal. So if they're equal, the thing that's going to draw the water in one direction or another is osmotic pressure. And we said that, yes?
I was going to ask, why is there something that makes it have to be equal, or it's just normal
It's just
regulatory system?
It's just the regulatory system. Okay. So, and we said osmotic pressure is due to what? What was osmotic pressure? Due to solutes. Depending on wherever the solutes are, the water's going to get drawn to the solutes. And one way that the body regulates that and moves those solutes around is through these pumps that are in the wall of the cell, right? Remember the sodium, potassium, ATP pumps? So this ATP pump is actively moving potassium into the cell, down up its concentration gradient, and sodium out of the cell, up its concentration gradient. And depending on where these sodium and potassiums move, they draw water towards it, okay? So if the extracellular sodium concentration changes in any way, it will affect water movement, okay? Why? Because water follows salt. Okay? Any questions? So key point being water moves due to what pressures? Osmotic and hydrostatic. Okay. Today, we're going to be, a lot of the things we're going to be talking about will be mainly osmotic pressure, but you have to remember there's hydrostatic pressure as well. Okay. So now we're going to be talking about water balance. Okay. The term balance means some sort of equilibrium, right? So imagine this box is your body. Okay. Water going into your body has to equal water leaving your body every day. Right? Water in has to equal water out. We need to think about what are the ways that water enters your body. Water enters your body mainly through drinking. About 60% of the water entering your body is through the liquids you drink. Right? But it also enters through any moist foods that we take in, that we consume. 30% of your moist food, of water entering your body is through moist food. And also 10% is the water of metabolism. That means when you take in nutrients, foods, the nutrients get broken down through metabolism. And one of the products of metabolism is water. You guys kind of remember your metabolism lecture, right? When we broke down glucose, it got broken down into carbon dioxide and water. So this is one way, breakdown of nutrients. One way that water enters your body. Okay. Water leaves your body through urination. 60% of the water that leaves your body is by way of urination, by way of the kidneys. 6% is by way of feces. 6% is through sweating. Sweating, you can actually see when you're sweating, you can see the water leave your, kind of sitting on the outside of your body through your skin. This is considered sensible loss. It's sensible because you can make sense of it, because you can actually see it, right? But there is also insensible loss. Water leaving your body in ways that you don't actually see. So 28% is through insensible loss. What are those insensible losses? Evaporation through the skin. So sweating and evaporation are different, right? Evaporation is when you're sitting here, you don't see the sweat on your skin, but there's water evaporating off of your skin, right? And also when you're breathing, the air that is in your breath is moist, right? So losing water through your breathing is considered insensible loss. And one of the ways you can prove that is if you're on a cold day, you're sitting in a car and close the car door, you can see the water building up in the windows because of the air you're breathing out, right? Yes?
What's the meaning of insensible?
Insensible means you don't make sense of it. It's not something you actually can see. Okay? Okay, so now that you know how water enters your body and how water leaves your body, you want to think about what are the ways that your body regulates that intake and output, right? Because we need to be able to balance out water in and water out. So because most of the water that is taken in is through drinking, regulating water intake is through thirst. Your body triggers you to be thirsty, and when it needs water, and if you're thirsty, you're going to be water seeking, and you're going to go drink some water, right? Because most of the output of water is through urination, the way that we regulate output is through volume change and pressure change, blood pressure change, okay? Volume change. If you have too much water or too little water, your body will control the amount of water leaving through ADH. How much ADH gets released. And by now you guys know what ADH does. Also, blood pressure. Blood pressure changes will trigger your renin-angiotensin-aldosterone system. Right? So that'll affect angiotensin production, which then also leads into ADH and aldosterone inversion and all that stuff. Okay, so the example given here is this. Here's one example. So if you have too much water loss, vomiting too much, urinating too much water loss, what will happen will be the blood in your body will be concentrated. So the blood plasma concentration will be high. Okay. If this concentration is high, there are osmotic receptors, osmoreceptors, that can detect this loss of water, and it will trigger the posterior pituitary to release more ADH in order to retain more water. Okay. So if more ADH gets released, you'll increase your reabsorption of water at the level of the kidneys by making more aquaporin. Okay? Any questions so far? So as a side note, we're talking about a lot of things that start with osmo this, osmo that. We need to make sure we're clear as to what we're talking about. So osmolarity, you're hearing about a lot. You may have also heard at some point osmolality, okay? And we want to know what's the difference between osmolarity and osmolality. They're pretty much the same thing, the units are different, okay? So osmolarity and osmolality are both measuring the concentration of solutes over solvents, but the units are different. So for osmolarity, we're looking at milliosms per liter of water, concentration of solutes over solvents, right? And for osmolality, it's milliosms per kilogram of water. So we're looking at mass versus volume of water. Okay? And how is osmolarity, osmolality, how is that different from osmotic pressure? Osmotic pressure, you guys already know, is due to the solutes in the solution that are going to draw water towards it, right? And those solutes, the reason why they would draw water towards it is because they're not able to pass through whatever membrane to leave whatever compartment they need to go to. Okay? So, osmoreceptors, which are located in the hypothalamus, triggers thirst. Okay? Osmoreceptors, which are located in the hypothalamus, can trigger thirst. You need to know that those osmoreceptors are sensitive to osmotic pressure, this thing that we were just talking about. Okay? So they can detect the osmotic pressure in your body's fluids, and then they can trigger thirst to occur. One key piece of information to remember. We're talking about what can trigger thirst, and we're talking about at what point do we stop the thirst mechanism. Okay? So how do we stop the thirst mechanism? One way to stop the thirst mechanism is this. The combination of these two factors together can inhibit the thirst mechanism. So by actually drinking water, the act of drinking water in your mouth, the act of drinking and swallowing the water, as well as the combination of when the water enters the stomach and it causes the stomach to expand, those two combined will lead to impulses that will inhibit the thirst mechanism. So if for some reason you're thirsty, right, I need more water, drink water, right? The act of drinking water, the water entering your stomach and the stomach expanding will send signals that will inhibit further thirst.
This is impulse is a little circle, or that's negative?
This is negative with a circle, that's inhibit. Okay. Any questions with that? Okay. So what triggers thirst? All of these things down here. This, what inhibits thirst, this is what triggers thirst, okay? So, one, if there is a decrease in total body water by at least 1%. If your total body volume, which is 60% of your weight, right? If that volume goes down by 1% or more, that will trigger thirst. Because if that volume goes down, that will affect osmolality, right? Also, if the volume goes down due to hemorrhage, so volume inside your bloodstream, the plasma volume goes down due to hemorrhage by 10% or more, that will also trigger thirst. It will affect your stretch receptors in your cardiovascular system, and that will trigger thirst directly, the thirst centers directly. Okay, so the difference that you're seeing is here's 1% and here's 10%. Okay, yes?
That 10%, is it saying specifically blood?
It's saying, yes, it's saying the cardiovascular system. So inside, volume of blood inside your cardiovascular system. Yes.
But it's still fluid, but it's just saying.
Fluid, but specifically blood, right? Okay. And if the blood pressure drops sufficiently by 10% or more, 10%, that will also activate the renin-angiotensin system, which then will stimulate the angiotensin II. It will lead to angiotensin II production, which will then stimulate thirst. Okay. So then the question is, why is this 10% and this 1%? What's the difference? Well, this is talking about all of the water in your body. If all of the water in your body, right, 60% of your body mass, drops by 1%, that's enough to trigger thirst. But remember, everything down here has to do with what's in your bloodstream, so plasma. If the water that's in your plasma drops by 10%, because plasma is only a part of your extracellular fluid, right? Whereas this is extracellular plus intracellular. So if the water that's in your plasma drops by 10%, that will also trigger thirst. And if the blood pressure drops by 10%, it will also trigger thirst. Now you can think, okay, these two are connected, right? If your volume goes down by 10% in your bloodstream, then the pressure can drop. But even if you don't lose water, if your blood vessels dilate somehow and drop your blood pressure by 10%, that will also trigger thirst. Okay? Any questions? Yes?
Could you repeat that part again, where it says after the hemorrhage 10%, the stretch?
Okay, so if you bleed out and you lose 10% of your blood volume, right? Your stretch receptors in your cardiovascular system, so in your blood vessels, there are receptors that can detect how much stretch is occurring in that blood vessel. The more water, the more stretch. The less water, the less stretch. Those stretch receptors will detect that loss of volume. And those stretch receptors, when they detect that loss of volume, they will then directly stimulate the thirst centers in your brain. Okay?
So it detects that it's not stretching as much in that case, right?
Right, it's detecting a loss of stretch. Does that make sense? Okay, so what we're gonna do is I'm gonna go to the presentation slide, go through all the stuff that matches what's on the board, and then we'll get to electrolytes.